Kathy's here. Of course, Kathy.
Okay, all right. I'm going to call this meeting to order on this 6th of May.
May the 6th.
Dave Gordon, Beth Hassett,
Here.
Terrence Jones, Olivia Kassiri, Bruce Wagstaff,
Here.
Scott Moak,
Here.
Phil Cerna, Donna Sneringer, Steve Wertz,
Here.
Lee Turner Johnson, Kathy Kosick,
Here.
Terry Porter, Christina Elliott,
Here.
Patrick Kennedy. We have a quorum. Beth Hassett will be chairing today in Phil Cerna's place, and Kathy Kosick will be voting for Olivia Kassiri today in her absence. This meeting of the First Five Sacramento Commission is cablecast live on Metro Cable 14, the local government affairs channel, on the Comcast, Consolidated Communications, and AT&T UVerse cable systems. This meeting is closed caption and webcast at www.sacmetrocable.tv. Today's meeting will be repeated Wednesday, May 8th at 9 a.m. and Saturday, May 11th at 2 p.m. on Channel 14. Members of the audience wishing to address the commission may sign a speaker slip at the kiosk located in the back of the room. Please include the agenda item number that you wish to address and then bring the completed form to me. Please speak into the microphone when addressing the commission and state your name for the record. If you have any electronic devices, please put them on silent or turn off now. Thank you.
Commissioner Wertz, would you please lead us in the Pledge of Allegiance?
States of America, and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you. First item.
Approval of the March 4th, 2019 draft action summary.
I have a motion to approve, or is there any discussion?
I'll move approval.
All right, all in favor?
Aye.
Oh, wait, do we need to do a,
Okay.
that's good enough? Okay. Aye.
Public comments on off-agenda items.
I do not have any slips, so I'm assuming there is no comment.
Executive Director's Report.
Good afternoon, Commissioners. Hope everyone is well today. I have a couple of highlights from the Executive Director Report. First is Advocacy Day recap. So huge thanks to Commissioners Elliott and Sneringer for joining Latina and Aaron and I at the Capitol to make our legislative visits. And we had our secret weapon, Harper Elliott, 5-year-old, along with us for the morning visits. And I think she did really, really well. She held her own there. Future lobbyist for sure. It did take a village to pull off our successful event, and our partners at First Five California and First Five Association really count on First Five Sacramento for a lot of the logistics, and we got a couple of hundred kids out there on the lawn for them and their families, and preschool teachers to participate in the lawn games and activities. I think I sent you some pictures of our first partner reading with the kids. We had Potter the Otter out there. It was a pretty fun day. And then, Christina, if you have anything you want to add at any time or during the sustainability update, feel free to do so. And be following up with our elected officials. We had some really great conversations around expanded home visiting, around trauma and Prop 63 funding, and just some various things that they were interested in, including the formation of a children's caucus, which Senator Pan was considering starting. So that was really kind of amazing. And everybody was very enthusiastic about young children right at this time. But we will wait to see, what the May revise holds, and if the talk about the children actually comes to fruition in our budget. The governor's budget is looking really good for kids, with $2.7 billion invested in First Five programming. But like I said, devil's in the details. We'll see what happens with May revise, but expansion of home visiting, earned income tax credit, developmental screenings, ACEs screenings, lots and lots of funding going toward those programs currently in the budget. Another kind of exciting thing I got to do was meet California's new Surgeon General, Dr. Burke Harris. She kicked off her 6-county statewide listening tour at Fruit Ridge Community Collaborative. I got to attend that with about 50 of our community partners, many of us working on the Black Child Legacy campaign and other programs. It was just a wonderful couple of hours, and she was so humble. She did very little talking herself, except to say what her 3 priorities were, and they're just so in line with what we do at First Five. And her priorities were to work on adverse childhood experiences and trauma-informed trainings across the state, improving birth outcomes, and reducing health disparity. This was like exactly what we try to do in the First Five world. So that was a wonderful opportunity. I have a certified sustainable update for you. 100% of our partners submitted their final versions of the sustainability plans. So staff and consultants and commissioners are looking over those plans right now to give just final comments and feedback. And we are planning a celebratory event to really recognize some of the outstanding strategies and groundbreaking strategies that they've identified in their plans. That event will be June 10th at the Crocker Art Museum in the Lobby Galleria area. You'll all be getting invitations to that, and I hope that you can join us. It's going to be pretty spectacular. We've also are inviting our local business community, folks from the 20th anniversary, other philanthropic organizations, to try to have a good mixture of our funded partners and other people who may fund them in the room together at the same time. Our community connections grants, actually the next thing up on the agenda, but just a follow-up from the discussion that we had at our March commission meeting. Commissioner Wagstaff had asked staff to look into bolstering our evaluation to see if we could include some child outcome measures. And so we met as a staff with our evaluators, and we met with the evaluation committee in March and looked over our end of term survey that we provide to each parent and asked them to complete for us. And we ended up adding two questions, sort of a 2-part question. It doesn't allow us to track kids over time or do any extensive, anything too extensive, but it does allow us to see if children who are part of the program then actually got connected to other services, health and developmental services, related services as a result of being part of Community Connections Grant. So we'll at least get to have that information, and we're going to develop a dashboard. So at the end of each year, we'll have like a 1-pager dashboard that kind of talks about parent feedback, what parents thought about their Community Connections grants, and gives you some statistics all in one place. So we felt like that was a pretty good compromise, just based on how little funding we have invested and how little funding we have overall left in our budgets for evaluation, but wanted to address that concern. So moving on, there's an update. First Five is partnering with First Five California and Sacramento County Office of Education on a dual language learner planning grant. So this is a research grant, short term, about 6 months for $100,000, and that will allow SCOE to hold some focus groups, talk to parents, talk to providers, and sort of assess at the local level how our dual language learner programs are functioning, and to feed that information back to First Five California, who is investigating 8 different counties across the state, so 7 others, including Sacramento. And then they will be releasing a significant pot of money in 2021 based on the findings from their research. So we're happy to be a part of this first stage of that. It's a 3-stage dual language learner process, with the funding coming out in the third stage. So we're just right at the very beginning right now, but happy to be a part of it. And in good news, other good news, we just found out, and this isn't in your report because I didn't find out till Friday actually, that Supervisor Cerna had submitted on behalf of Sacramento County, I'm blanking on the word, our submission to the National Association of Counties, NACO we call it, highlighting our Black Child Legacy campaign and the efforts to reduce African American child deaths. That project was selected as a winner, if you will, and which means we're getting some national recognition. It was an achievement award that will be presented in, I believe, whenever their 2019 national conference.
July. That's in July.
July. There you go. So kind of a big deal. We're getting that word. Our chair has really been wanting us to get that word out about the success that we've had so far. And so between some of the statewide First Five work that we're doing and now a national highlight shining on it. So pretty exciting. And finally, my last highlight is just touching back on the community baby shower that we had back in February at Fruit Ridge Community Collaborative. We had great representation from our agencies and our funded partners. There was 197% increase in traffic to our Sac Healthy Baby website, so people were getting on that website, and those 21 community-based agencies made 215 referrals to the women who were there into a myriad of programs and services. So we consider that a huge success. And we have our recap video, a very short 2-minute video that I'd like to show you from the event. Maybe. I can see it, but I can't hear it. Such a good way to end the executive director's report. We were just so happy with the shower, and for us, sort of the 20th anniversary, I think, was our tipping point in a way of elected officials really showing up and participating, and we had so many more that we had thought were going to come to the 20th anniversary. You know, we were like scrambling to get everybody a place in front of the mic, and then at the 20th event, we didn't get footage of Assembly Member Cooper, but he showed up. Numerous school board members showed up. Reps from both of our congressional people. I mean, like, it was just a packed house of elected officials wanting to be seen as being a part of the First Five efforts, and that has just really evolved over the last couple of years. So I couldn't be more delighted. And that concludes my executive director's report.
Thank you. Commissioner Moak?
Thanks for that. The video is great. Maybe just a quick question kind of about that. Looking through some of the digital communication part of the report, that video, I don't know, I can't remember if I saw it on our Facebook, if it was posted to our Facebook page. But that nonetheless,
I know Phil posted it to his Facebook page.
Yeah.
And then it may have gone viral after that. I'm sure it's on ours, but Aaron's not here, and so I can't.
Sure, I know.
100%.
She said that there is a video ad that delivered 20,000 impressions. I don't know if that's the video ad.
That might be it. I don't
So, I mean, I would literally on all channels, maybe not, obviously not Pinterest, but with Facebook and Instagram, I would literally keep posting it or use it as what's called a promoted post, I think. And so it just keeps kind of coming up, because there's a lot of great, it could be cut down a little bit if you wanted to do that into a 30 or something a little shorter. But that's a good piece for families to see on social, and because it does all the things that you want it to do. It gives moms and new parents and families a chance to kind of learn and hear a little bit more about what's happening. It does the other, like, what's for First Five? Like, what do they do? Like, it's
Right.
So it just kind of, it cuts at a lot of topics. So I think that if somehow you can see if Aaron or the team can't get that posted regularly,
Yep.
because it also has a shelf life. Like, you can, I mean, it will, or it doesn't. It'll actually, it
kind
can
of
continue on.
evergreen. Yep.
And then on that note, it'd be fun to see some of the movement of the social media reporting, meaning like it'd be like to see, we're at 14,000 Facebook likes now. I know that's 100 new in March, but seeing it maybe in a different format, a bar chart or something else that can show a little bit more growth, and especially year over year, month over month growth, can be helpful. I think then when you post things like that video or other good content, you'll be able to track and see actually what's doing what and when and why and all that stuff. So I feel like this chart, I'm sure, is being sent to her by the grid.
Yep.
That's my bet.
That's my
and if they have the ability to put this stuff into different formats, so maybe just ask them for something that's a little more viewer friendly for us, I think. A little more comprehensive.
Yeah, perfect. We'll do.
Trend line.
Trend lines are good.
All right, thank you. Next item?
Advisory Committee update?
I don't see Mr. Silva.
I don't see him here, but I can give a quick update. So we did meet on April 12th, and I really just took 90% of that time to talk with the advisory committee members just about all the stuff happening at First Five. We typically have one or two presentations, and there isn't a lot of time to just sit and talk and ask questions and go around the room and do share outs. And so that is primarily what we did at that meeting. And then at the end of the meeting, one of our Community Connections grantees, who is a Hmong mother working in the Hmong community on language and arts, came and gave a presentation to the group, and they were just really interested. And she wears a beautiful outfit and keeping culture alive in Sacramento. So it was lovely, nothing earth-shattering, but just lovely to have like a calm, nice meeting.
Excellent.
Evaluation Committee update?
Yes, we also met on March 18th, and I'm glad to report that we had a quorum. And I want to thank David Gordon and Tony Smith and Robin Blanks as our two new advisory committee members. And so we had a quorum, and we were able to catch up on our past activities. And then we had a full meeting, sort of as Julie has mentioned, around looking at the community grants and the evaluation piece of that, but we also looked at the evaluation of the Birth and Beyond program and the reconvening of the work group around that, and we took some time around that. We also were highlighting the integration of the CalWorks home visitation into our planning as well, and into the evaluation piece. And so I think I'm going to sort of leave it at that it was a very productive meeting. We provided input for the staff on the community grants, and we are moving forward on the evaluation for Birth and Beyond. And our current ASR representatives were there to present everything they were doing on the evaluation piece as well. So it's a full report from them, and I think we're in good shape now to keep going with the evaluation committee.
Yep.
Financial Planning Committee update?
At our April 4th meeting, we reviewed the update on the recent efforts to analyze the Medi-Cal administrative activities time study systems that are available on the market to determine if an upgrade is needed and prudent. Staff provided an update on the implementation of the CalWorks Home Visitation Initiative. Much of the early efforts are focused on service delivery systems and staff education and the cleaning processes. The state required submission of all executed agreements and for a client to be served on or before April 1, and that objective was met. We reviewed the recommended budget and 10-year financial plan, and changes from the prior year were discussed. And the item today is on the agenda as item 11, and the Financial Committee did approve that. Quarterly financials through March 28th were reviewed, and everything appears to be on target at this point.
Great, thank you. Next item?
Sustainability Committee update?
We didn't meet, but I will add to Julie's comments about the Advocacy Day. Harper's 5, my youngest is 5, so there's it was a little bit weird for me to think that she has outgrown these first 5 years kind of already. So thanks to First 5 staff, First 5 California for hosting Adeline and Harper over the last 4 years for this day. It's been a really important part of their development to be able to see me working, advocating for their peers. I really think it's been priceless. So I'm excited to see how this sets some foundations for them, and I can't articulate how grateful I am to have been able to bring them, and I look forward to bringing them, continuing to bring them, but during their first 5 years, they got to do this, and I think that is just amazing. So thank you. It went really well. Harper didn't squish any Oreos into anyone's carpets, so that's always a win, like Adeline did. Everyone was really receptive of Harper, and I'll say, from the first time we did this to this year, I feel like this year we finally were treated like the experts that we are, and we were treated in a way, not that we were treated poorly, but no one knew who we were. And that wasn't the case this year. Right. Everyone understood who we were, what we stood for. They didn't know everything, but I think that speaks to the diligence of First 5 California, First 5 Sacramento staff, everyone that participates. The presence at the Capitol exists now, and we're going to start to influence policies like we're doing. That's what the sustainability plan is all about, all the work that we're doing. So we're seeing the fruition of these efforts firsthand, and that's incredibly exciting. So that's all.
Thank you.
Approval of community grants connections. Connections grants, sorry.
Good afternoon, Commissioners. Today I'd like to present to you the new CCG groups that we're going to recommend for funding. This is what we know now is around 7 ever since the grants were relaunched in 2016. There were 6 proposals that were received, and all but one are being recommended for funding. The one that did not pass has received some valuable feedback, and we also connected them to a community partner, and we're encouraging them to reapply. The total amount of funding for these community grants is up to $24,575, and these funds have already been allocated to the fiscal agent, CAPC. So you all have a chart in front of you of the 5 grants. As you can see here, the little baby chatter and everything that the CCG is in the house. And I am going to introduce you to them and ask each group to stand as I mention their group. The first group is Cafe and Play, and their sponsoring agency is the Liberty Towers Church in the North Highlands area. This group will focus on parent-child bonding, school readiness activities around healthy habits, and parents will be empowered to take leadership roles at group meetings, while referrals and resources will be provided to the families to strengthen their support system. The next group is Elements of Play. The sponsoring agency is the Sacramento City Unified School District School Readiness Program. This group will consist of week-long summer play groups and then monthly meetings thereafter. The children will experience play through music, arts and crafts, story time, and gross and fine motor development. Most play groups will take place at the South Side Park and at the library. The next group is Healthy Bodies and Healthy Hearts, Mommy and Me group. The sponsoring agency is Tarbiyah Institute. And this group will reduce isolation among Muslim mothers of small children by meeting monthly to model healthy behaviors of nutrition and physical fitness. Some activities will include presenters, a family fun run, Mommy and Me exercise, story time, and cooking demonstrations. The next group is the Learn Hmong with Me expansion with the sponsoring agency of the Elk Grove Unified School District pre-K educational program. And this is an expansion of a current CCG group that's focused on young children celebrating Hmong culture and vocabulary. Through this grant, they want to expand to strengthen parents as advocates, and they'll receive valuable information about parenting and their child's development. They'll include workshops such as emotional literacy, preschool enrollment, special needs, IEPs, and to make sure that parents are informed to get their child ready, prepared for kinder. And the last group is Your World, Your Canvas art project. And the sponsoring agency is the Praised by Nature Ministries in the Rancho Cordova area. And this group will provide opportunities for families in the neighborhood to come together and bond through art projects with their children and grandchildren. The art projects will include ways of fostering the child's creativity and boosting their self-esteem, and they will be meeting monthly.
Thank you. My favorite thing about these projects is just seeing how creative everybody is and finding things that resonate with their communities and with the people who are going to participate. So we look forward to hearing how everything goes. And we need to vote on this item. Oh, yes, wait. Scott Moak and then Bruce Wagstaff.
Thanks. So agree with Beth. So cool. And thank you all for taking the time to go through the process to apply and ultimately be awarded the funding to be able to do these cool things. It's so neat to see and hear the creativity that you're using to help the communities you're in and seeing you like rally together. And what's cool is like, I hope you all are getting to know each other, which is like a sub benefit, but an intended benefit of what this is ultimately supposed to do in building social capital and making connections, which makes me, I feel like we did this a long time ago, or maybe you still do, so just help. Is there an opportunity to bring forth either former grantees, current, but not necessarily all of them, but maybe ones that want to participate in some kind, what it reminded me of is when you said a children's caucus, like some kind of smaller group that could be a little bit of an advisory-ish council to help just in future iterations of this project and program. I feel like we're gonna, as we move forward, years forward, this hopefully isn't an initiative that's gonna go away again. So it would be great to have the actual experts providing some counsel and feedback on how we can continue to improve it, just so that they can be very honest about what some of the best parts of it are, what some of the challenges, the true challenges are.
Good idea.
Just strikes me that I feel like we did that once a long time ago. I remember the women from the park over by where B Street used to be. They had that big festival that they would do monthly, and they were really spearheaded kind of the feedback. I don't know if you remember. That was a long time ago, so I don't know do you remember that? So the model, I think, exists for it, to just basically ask their input.
Great idea.
And then I just want to make sure not to freak our Sac City Unified, the fiscal agent, the group, which is the elements of play, but do we have a backup plan for Sac City Unified Schools?
We will discuss that. I know that they were heavily involved there. This is kind of like a phase 2 of this play group.
Okay.
And they were very supportive, so I do think there is.
I would just hate for them to not to have any kind of issue or red tape around getting their money from the district in a time when could be challenging for the district.
Yes, and the fiscal agent is CAPC, so actually the sponsoring agency receives no funds. They're just supporting.
That's right. Cool. That's all.
Thank
And
you.
if that
Commissioner
can't
Wagstaff.
happen, We'll find another sponsoring agency too. Yeah.
Thank you. And I wanted to thank staff and the evaluation committee for the follow-up on the discussion we had last meeting on these grants. Much appreciated. As Julie mentioned, we don't spend it that much on these, but I'm sure the commission agrees that it's not really the issue of how much you spend in areas, but being accountable for our outcomes on all of the areas that we fund. And so I really appreciate the work that was done here. But again, it's not so much how much you spend. I mean, I would have to say that as I look back, I've spent probably frequently a disproportionate amount of time on programs that we fund at the county that if you just looked at how much was spent on that program, you wouldn't think justifies the discussion, but nonetheless, we do that. So I appreciate the work on this, and I'd like to move the staff recommendation.
All right, thank you. Do we have a second? Roll call vote?
Beth Hassett,
Aye.
Terrence Jones, Kathy Kossick,
Aye.
Bruce Wagstaff,
Aye.
Scott Moak.
Aye.
Motion passed.
Take your money and run.
2021 strategic plan process approvals.
Okay, well, they say time flies when you're having fun. I can't believe we're talking about our next strategic plan so quickly. As you know, we are in year 1, just wrapping up year 1 of our current 3-year strategic plan, the 2018 to 2021 plan. But it is already time to convene a strategic plan work group and talk about a strategic plan consultant for the 2021 strategic plan. And so to that end, we want to make sure that we give the commission ample time to identify and agree on its priorities, to set up that spending plan that then staff are able to go out and host the competitive bid processes for the applicants to join us in this work. That all takes about 18 months. So it is time by the end of this calendar year to get that started up again. So we will need to establish an ad hoc First Five strategic plan work group and bring on a consultant. And so the work group will consist of 5 members, represents 3 commissioners and 2 advisory committee members. The advisory committee members will be appointed. I had 5 people interested on our advisory committee and only the 2 slots, so they will be appointed at their June advisory committee meeting. And then for commissioners, we have 3 openings, and Commissioners Hassett, Moak, and Wirtz have graciously agreed to help us out with this this year's strategic plan, or this cycle's strategic plan. The group will meet monthly beginning in August or September and probably go through end of the year and maybe even into January, February, depending on how long it takes to all get to those major decision points before we bring it forward to the full commission for approval. It also goes to the Board of Supervisors before the commission gives a final approval, all of that happening in first couple months, I believe, of 2020. And then as far as the strategic plan consultant, this would be a person or agency who helps us to facilitate those meetings, because staff actually are pretty engaged in the conversation of those meetings and oftentimes presenting data, strategies, and other things to the work group. So a facilitator who would help us with those and then write the actual document itself when that time comes. So the staff are recommending that the commissioners appoint the strategic plan work group and authorize the executive director to release a request for applications for a consultant to facilitate and write that plan. You would have an opportunity in August to consider approval of the recommended consultant after a competitive bid process takes place this spring and summer.
All right, I have a request to speak from Commissioner Kosick.
I had a quick question on the, where did we arrive at the 19,000 not to exceed number? And do you recall what we paid the consultant last time we did this?
Yes. So we had $19,500 in our 2018 line item. We have a little bit less this time, but we spent out that entire amount in 2018, and so we're thinking it will be roughly the same for this time around. And it's a lot of it is the meeting prep. It's what happens in between the meetings of the strategic plan work group, because we're staff and consultant are working together on creating the tools that the work group will use to prioritize, and then it's the writing of the plan that kind of takes the time.
Okay, thank you.
Sure.
All right, so we need to vote on this. Do I have a motion?
So moved.
I'll second.
All right, roll call vote.
Beth Hassett,
Aye.
Terrence Jones, Kathy Kosick,
Aye.
Bruce Wagstaff,
Aye.
Scott Moak.
Aye.
Motion passed. Approve a revenue agreement with Sacramento County DHA for the CalWorks Home Visiting Initiative in the amount of $3,269,830 for the effective January 1st, 2019 through June 30th, 2020, and execute a contract amendment with the Child Abuse Prevention Council of Sacramento Incorporated for the home visiting program to increase the contract by $99,508.
Madam Chair, I need to recuse myself from this item.
And the reason for that is Commissioner Wagstaff's oversight of the Department of Human Assistance.
We still have a quorum.
5.
5.
We need 4.
Got 4. We just need 4 votes to.
Correct.
Oh, 4 to it. Yeah, 4 to it. You still
We're good.
We'll do. Dated myself.
Good afternoon, Commissioners. My name is Chris Clinton. I'm the Program Planner for the CalWorks Home Visitation Program. And today I have 2 items for approval. Back in December, First Five signed a 6-month revenue agreement with DHA for the CalWorks Home Visitation Program at the request of DHA. And now we will need to enter into a 12-month revenue agreement for the remainder of the 18 months. At this time, staff is requesting approval to enter into a new revenue agreement in the amount of $3.2 million. This new revenue agreement will take us through June 30th, 2020. And then back in September 2018, the California Department of Social Services awarded $4.8 million for the CalWorks Home Visitation Program in Sacramento. But in January, CDSS allocated additional funding of $104,745, bringing the grand total award to $4.9 million to Sacramento. Today, staff is requesting contract authority to amend the Child Abuse Prevention Council's contract for the additional amount of $99,508, bringing the contract total to $4.7 million.
It's a lot of numbers.
I know,
Sorry
a
about
lot of
that.
numbers. I had to read them. I didn't want to botch it up.
All right. I see no one requesting to speak. We do need to vote on this matter. I will move that we authorize the executive director to enter into this revenue agreement.
Second.
We,
Any
yes,
second? Okay.
second.
Beth Hassett,
Aye?
Terrence Jones.
Aye.
Kathy Kossick.
Aye.
Scott Moak.
Aye.
Motion passed.
Thank you.
Public hearing,
No brainer.
approval of recommended budget and 10-year financial plan for fiscal year 2019-2020.
Good afternoon, ladies and gentlemen of the Commission. My name's Eric Harold. I'm the Chief of Administration for First Five Sacramento. And to continue that theme of a lot of numbers that Chris just established, I'm going to ask that the Commission review the fiscal year 1920 recommended budget and 10-year financial plan and approve it. This budget is the second year of the 2018 implementation plan and reflects all the funding priorities and goals as approved by the Commission. The fiscal year 1920 recommended budget was submitted to the County Executive's Office on February 21st, 2019 for review and comment as required by county ordinance. Now, if you go ahead and refer to attachment 1, we'll go ahead and get into the budget numbers. Okay, on attachment 1 at the top, you can see that we're asking for appropriations in the amount of $22.9 million. And out of that $22.9 million, 5% goes to administration, 2.5% for evaluation, and then finally 92.5% for program services. Immediately under those categorical breakdowns, you can see how the budget appropriations are allocated amongst the programs. For each program, it has a percentage of the total budget as well as the dollar figure that's available for, or being requested for fiscal year 1920. In the bottom right-hand call-out box, we have reserve fund information. At the beginning of fiscal year 1920, we will begin with a reserve fund balance of $23.1 million. We will have a projected fund balance to begin the year of roughly $1 million. And we will require a reserve release of $5.6 million to augment all of our revenues so we have enough funding to support this $22.9 million allocation request. So if you look over to the left, you will see the revenue, the listing of the revenues, and also the augmentation from the reserve fund. There's a total of $16.3 million in revenues when added with the $6.6 million from the reserve, we come up with a total funding of $22.9 million, which is equal to the allocation we're asking for. And one other point I wanted to cover on the reserve balance is, although we are starting with the $23.1 million at the beginning of the year, after the reserve release, we will have a projected ending year balance of $17.5 million in the reserve fund. Okay, if you want to go ahead and move over to attachment 2, the budget detail. On the budget detail, I wanted to highlight basically some changes that are occurring from fiscal year 18-19 and into the request I'm making for the fiscal year 19-20 recommended budget. Excuse me. The first item I'd like to cover is the blue highlighted numbers that are 2 rows above the green highlighted row. And this is the investment services account. If you see the first blue highlighted number, we asked for in fiscal year 18-19, almost $1.7 million for this for 18-19 budget. And for the current year, for the 19-20 budget, we're asking for $79,000, which is the last highlighted blue number. And the reason behind that is for several years now, we've been carrying about a $1.6 million liability that needs to be paid back to the state in the form of Medi-Cal administrative activities backcasting. That's where the state went back and looked at many of our invoices and recalculated it based on a new formula and concluded that we owed them back $1.6 million. So finally, that's been budgeted for several years, and we have finally paid that money back, so it is no longer required to be budgeted. And that's the reason for that drastic reduction. And then next, I'd like to look at the green highlighted row, which is where we budget our community-based organization contracts, which are the contractors that we hire to do our direct services and various other things. And we currently have about 40 contracts, give or take a few. So within this account, you can imagine there's going to be a lot of changes going on, and I'll cover the notable changes. Ultimately, we had a request from fiscal 18-19 for $19.5 million, and this year we are asking for right at $20 million. And here are some of the notable changes within that account. First off, we have the CalWorks home visiting initiative, which provides $3.1 million in extra funding to the Birth and Beyond program, which is our family resource centers. Then we also have some reductions that go along with that. If we just added 3.1 million, it'd be much higher, but there's some reductions that go along with that happened in this account. And that includes a $1.9 million reduction for the capital projects. If you recall, we're doing the fluoridation in the Arden Arcade area. And then we also had a little bit of a budget for the Galt Dental Clinics that we're finishing those capital projects. So assuming those projects are finished in 18-19, we will no longer need to budget those, so it's a $1.9 million reduction. However, I will let you know that probably will change during the adopted budget process because I'm getting information that I'm not sure if the fluoridation project will be completely done this year. But that will be updated in the adopted budget process. We also have a $325,000 reduction that was graciously provided by the Board of Supervisors to the Birth and Beyond program as a one-time funding that intended to help the Birth and Beyond programs get to the CalWorks program funding, because that did not start till January 1st. So the board did provide some funding in the interim, and that needs to be reduced out of the account. Then we have a $200,000 planned reduction in the health program services contracts. This was where a contractor elected to take a higher allocation in the first year of the implementation plan. And so therefore that is a planned reduction for this coming year that they are aware of. Then we also had a $150,000 reduction in the dental contracts. And this was also, as I said, planned where the Center for Oral Health is going to assume more responsibilities for some of the services provided, so there's a $150,000 reduction. And then finally, when you have 40 contracts over the span of three years, there's going to be some adjustments, minor adjustments amongst all the contracts. And the net of the remaining contract adjustments is a $60,000 reduction. And overall, all these reductions end up in a $460,000 increase to the other professional services account. And then one other thing I'd like to cover are the revenues, which are listed at the bottom. I highlighted the main one, the main increase, which is $3.3 million for the CalWorks Home Visiting Initiative. So that was an increase in our revenue. And then we also have approximately a $750,000 reduction in Proposition 10 funding, which was due to a revision from the state of California First Five in their revenue assessments for tobacco excise taxes. They also worked with the Department of Tax and Fee Administration. I have to think about that name. As formerly the Board of Equalization, but they work closely together to plug in the formulas with their estimations, and then they provide estimates for each of the counties of what they should expect for revenues, and we use those estimates. And then finally, the $325,000 that I had mentioned before has to be reduced out of the revenues provided by the Board of Supervisors for the Birth and Beyond program as one-time funding. So those are also reduced. Okay, so moving on to the 10-year financial plan. This is basically, in my mind, a long-term planning tool to make sure that we're going to meet all of our funding priorities and still achieve the goal of having $3 million in our reserve account when we officially stop using the reserve funds. Okay, so the green highlighted column on this represents the fiscal year 1920 recommended budget. Basically, for an analysis of this, I would look at the beginning balance. We have $23.1 million. We have, as I stated before, a $1 million fund balance, and we're going to require a $5.6 million reserve release, which would leave us with the $17.5 million ending balance for fiscal year 1920. And I'm going to progress through the years looking at that reserve fund balance, and I'm going to progress through the years until I get to fiscal year 23-24, where you can see that the estimate is we will end that strategic plan period with approximately $3 million in the reserve fund, which is when we stop using that to support program activities. So that meets the criteria that we're looking for. Moving down to the revenues, I have listed all the categorical revenues that we are looking at, and I'll go over a couple of assumptions that we use in figuring the Prop 10 as well as our interest. As I mentioned before, Prop 10 is we get an estimate provided by the state, and we are using those estimates. Those estimates go all the way through fiscal year 22-23, at which time I use the historically natural declining rate of 2.5% to estimate the revenue for Proposition 10. And for the interest income, it's quite simply we use a 1% interest rate based on the amount that is in the reserve fund. Obviously, that's going to fluctuate from year to year, but find that 1% is a safe figure to use at this point. And then moving on to the expenditure section, for the current year, the fiscal year 1920 recommended budget, I have all the program allocations put in. And then for the immediate next year, 2021, I use the commission-approved implementation amount of $19.8 million to encumber those funds that have already been approved for expenditure in the next year. Then, if you look at the 2021 strategic plan block, which is the next 3 years beginning in 21-22, you see the amount that's available for the next strategic plan periods if that's what is elected by the commission. Roughly 14.4 million is available for each year for the next strategic plan period. Now that number actually will change quite often in the sense that if we do better on our savings, if we don't spend as much money on our contracts, if our revenues perform better or worse, it will have an effect, and any kind of commission actions that have a financial impact will all affect that next strategic plan period amount. And then finally, I want to move on to the bottom box, which I have labeled as implementation plan adjustments. I just got done saying that the commission had approved $19.8 million for the implementation plan, and yet I'm requesting a $22.1 million budget. So obviously there must be some adjustments that I've made, and there are, and they're captured here. And obviously the major one is the $3.3 million in the CalWorks Home Visiting Initiative. That is not part of the implementation plan, but it is part of our budget. And then there's a small reduction adjustment of $135,000 that accounts for some changes in the contracts. Some of the contractors asked for a lower amount in the initial year, so they can provide COLA increases for each of the years in the strategic plan period. And so when those adjustments are applied to the $22.1 million request, it comes out to a $19.8 million, which is equal to the approved amount by the commission for the implementation plan. And that concludes my report. Told you numbers.
All right, we need to.
Are there any questions?
Yeah, Madam Chair, if I might.
Oh, yes.
Going back to attachment 1, first of all, thank you for your presentation. Sure. Thank you. But going back to attachment 1, the breakouts you have there at the top for administration, evaluation, program, personnel, et cetera, are those the same percentages that we had in the current year and previous year budgets for those categories?
They're close to the same. I wouldn't say they're exactly the same. For administration, we're allowed to have up to 10%, but we traditionally have been around 4 or 5%. I believe we've even reduced evaluation a little bit, not much. And program has historically been around 90 to 92%, yes.
Okay, thank you.
Commissioner Wirtz?
Thank you also. I understood it sort of as we went along, and I had several questions as we did, but I'm seeing as I try to track that I had a question about whether the Prop 10 amount was consistently referred to across here, and in the end, the one on attachment 2 for the forecasted 18-19. In the red at the bottom.
Yes, sir.
It refers to what I was thinking is the allocation from Prop 10, and it's slightly higher, 11.9 versus the 11.4, I guess.
Yes, on attachment 2, that is more of a generalized. It's part of our accounting system. Chart of accounts is what I'm trying to think of. So it's generally state revenue, and so it includes multiple things, not just the Proposition 10. We also have the CB cap, which is another $444,000, which is child prevention type funding. So it won't be completely consistent across because it does include other accounts.
Thank you. Another minor thing, and there's probably constraints on this but this is the same interest rate that I get at my best money market or something. But I would just wonder whether there was any. I mean, there's probably constraints on what you can do with that money. You probably can't invest it wildly or something.
Correct. Well, we really have. It goes into the county's treasury, and they manage the investments. To be fair to them, it has been performing much better than 1% lately, but so is the market, except if you want to look at today, I understand it's kind of going down. So, but we don't do that, right? So, but that's under the control of the county.
Yeah,
so
understood. And I understand there's probably tons tons of reasons and constraints and whatever for that. And I guess the other thing I had, I wanted to look at how much went to our program. So back up to, let me just see which line it was that I'm trying to look at that was around, I was trying to compare it to our previous years of how much we put into program. And it looked like we were around 20 million on across the table. So I can't seem to find where I was looking at there. Maybe it's the green, well, so under professional, back to attachment 2, the professional services. 17-18 actual shows 20.5 million. And then 18-19 forecasted is 20.3.
Correct.
And we are looking at 20 for the next proposed budget. So that's staying about the same. Is that all three of those are in our current strategic time period? The 17-18 is prior?
The 17-18 is prior, and it was before we did our 20% cut.
Right.
But what's making it look even in the future year is the CalWorks home visiting
okay,
is in there, even though, and it is program, and it is a contract out to CAPC, but it's not going to be reflected in our budget over here because it is separate money.
Yeah, got it.
Yes.
And then I see that on attachment 3, under expenses, in the green column, the CalWorks and effective parenting looks like it adds up to 11.8 or something.
Right, correct.
Yes.
Okay.
Yeah, because prior year reporting, we didn't have the CalWorks, so
Right.
it wasn't an item in
Right.
18-19, and I've just added it for the 19-20 budget to kind of show a sustainability effort there.
Yeah.
That's being made, so.
And so that basically indicates that we are getting, because of that addition from the state, we're getting a little more substantial increase into our home visitation, family resource centers, effective parenting kinds of activities.
Correct.
Yeah.
Yes. Not coming out of the first 5 pockets.
For the CalWorks
For the
piece.
CalWorks
but
piece.
we're coordinating that effort
Correct.
to integrate it.
They took a 15% cut from our 17-18 year going into the 2018 strategic plan. And then through the CalWorks home visiting program, including the 100,000 that y'all just approved for today, 99,000. They are slightly ahead of than where they were in 17-18 now because of that CalWorks home visiting. So fully sustained for the 0 to 5.
Excellent. Well, I'm glad that we had a
Yes.
way to maintain that set of interventions as a partnership. And
We all are very delighted with that, yes.
okay, thank you. I think that takes care of my questions.
Excellent. We do need to vote on approving the budget and the 10-year financial plan.
Oh, first, it's a public hearing, so you have to open
Oh.
it for comment and then
I
close
do
it.
not see any slips, correct?
Excuse me?
Do we have anybody speaking? Oh, I have to open the public hearing. Okay, open the public hearing.
Now close it.
Closing the public hearing. Now, do I have a motion?
I move recommending the budget
And the 10-year plan?
and the 10-year financial plan.
Do we do, can we do them as one item? Yes, okay. Do you have a second?
I'll second.
Thank you.
Beth Hassett,
Aye.
Terrence Jones, Kathy Kossick,
Aye.
Bruce Wagstaff,
Aye.
Scott Moak.
Aye.
Motion passed.
Next
Public
item.
hearing, annual review of 2018-2021 strategic plan.
Good afternoon, Commissioners. Can you hear me?
Yes.
This is our annual review of the First Five Sacramento's 2018-21 strategic plan. This is actually the second time that we have reviewed, even though we are operating under the first year and starting our second year later this year, July 1st. This is a requirement of First Five California's policies. Our plan was approved on June 5th, 2017. with a proposed spending plan of $60.1 million. At this time, you can see on attachment 1 that is our hierarchy, which the implementation plan is based on, and we are asking no changes be made at this time. However, on June 4th, 2018, after the request for applications and proposals were released and approved, we came back to the commission and updated the current version of the implementation plan and strategic plan to include a reduction of funds. So our total expenditures are now $59.3 million on the strategic plan. Therefore, our planned expenditures for the 3-year strategic plan total $59,328,128, which includes administrative and evaluation cost. No changes to the 2018-21 strategic plan are recommended at this time. This public hearing will satisfy the requirements of the various statutes of the Children and Families Act of 1998, and that concludes my report.
All right, we'll open the public hearing. Close the public hearing. And there is no vote needed on this.
Yeah. Public hearing, First 5 California Annual Report for 20.
Oh, wait.
Oh.
Commissioner Wirtz.
May I speak
Sorry.
to?
Yes. Sorry.
Just a clarification. So this, the budget now with the $59.3 million does not include the CalWorks piece, correct?
Correct.
Okay.
Correct.
And so that was the simple clarification. And then can I backtrack on a question I didn't get to conceptualize fast enough on the prior thing to Eric? I see in, again, attachment 3 that there is no projection for future expenses around any of the items, but not the CalWorks piece in general. What's the status of the CalWorks for year to year? What do we know about its status for the future?
We anticipate it's going to continue. It's not a guarantee. I debated whether or not this extended all the way out or not on that form. I eventually just selected to keep it in the years we know we have contracts for, but we do anticipate it extending.
Understood. And we sort of anticipate, I know we're now guessing, but we think that this might become a stable state fund. I know we don't know that, but is that the best assumption at the moment for good news?
It is. It is, just even based on our day at the Capitol and what
And
we're
your
hearing
great work on the Sustainability Committee.
Yeah.
Thank you very much, committee.
As stable as any state funding can be.
Yes,
Understood.
exactly.
I'm not holding anyone to that. The main reason I'm asking is because it's not accounted for in our plan budget,
Right.
and we will be starting our planning for the future. So I wanted to get it clear that that will be a separate part of our planning processes to assess. We'll ask Bruce what he thinks. All right, thank you. That was helpful.
What's in the governor's proposed budget right now, we'll know more next week, is actually an expansion of the CalWorks home visiting to serve even more families. So if everything goes as we would hope, it would be extended multiple years and with even more dollars invested. And that would be solidified in the budget process, state's budget process.
And we think that will still fit in our integrated plan for how to reach the families that we in Sacramento and the commission want to see. I know there's a difference in the eligibility and so on, but we're thinking that will still remain an appropriate and good mix of at-risk and families of needing support.
Absolutely, yes.
Okay. Thank you.
All right. Next item.
Public hearing, First 5 California Annual Report for 2017-2018.
Hi again. We're conducting a public hearing on the First 5 California fiscal year 2017-18 annual report. As you may all remember, back in October, I came to you all with our data that we would be submitting to First Five California. And so the report in front of you is a showcase of all of the 58 counties and their data. This is a requirement of the Children and Families Act of 1998 that we, submit a fiscal audit and an annual report to First Five California, that we also perform an annual audit and submit the report to county commissions, the governor, and state legislature by January 31st, and that each county commission hold at least one public hearing on the First Five California annual report. This report covers the period of July 1st, 2017 through June 30th, 2018, provides a comprehensive overview of the state's programs and services. If you go to page 2 of your commission letter, I have highlighted that in 2017, First Five California received $70.2 million. That was actually a reduction of $9.7 million from the previous year, or a 22% reduction, which it falls in line with what we are seeing here locally. County commissions received $280.8 million, which was an 18% reduction. The county focus, if you move down further on the letter, you see that the expenditures in the 3 primary result areas were $341 million, or 23% reduction from previous years. And in the other priority, which is improving systems of care, there was an expenditure of $67 million. Further, the report beginning on page 33 highlights county commissions, programs, and you can find our local First Five Sacramento's highlights on page 43. This concludes my report.
Thank you. Commissioner Wirtz?
Sorry to be talking so much, but I think it's really critical. The issue of how First Five California was presenting itself and positioning itself to the public was really important. I think there was a real awareness at the association level as well as the state commission around whether First Five was able to present a story of success across the state. And I would like to get a sense whether you feel like this is an improvement on how they've framed and how they're making the case that this investment for children and families has been substantial and valuable to continue. So that's one question. And then the second was around our Sacramento component that we put in, and we really highlighted the sustainability piece as opposed to in the past we often have highlighted a program and so on, and maybe just some statement about the rationale for that. So 2 questions. One, how do you think this works as a rationale and justification for these funds? And 2, the rationale for our picking to highlight one of our innovative efforts around sustainability.
So for the how do I think it turned out?
Right.
I think they get better and better. It used to be several hundred page, door stopper, and now it's down to what they're considering the critical information. First Five Association is really working with the county commissions to identify how best to tell our story. This is more of that, we have to submit something to the legislature, it's First Five California, it's sort of their priorities, their budget, and it's based on their strategic plan, not necessarily the plans of each of the counties, which all vary. That variability has been the hardest part in telling a statewide story, because while we all might invest in home visiting, we all have different models that we use or different evaluation tools that we use, and so it's challenging. I think First Five California's probably given up on really trying to tell that story, they haven't given up, but it's difficult. So now we're focusing as an association and specific executive directors and First Five California team to really just tackle it by topic area. So we have a topic area that we're focusing on right now and holding meetings across multiple county commissions and state and association is home visiting. We see it as a priority. We're being asked questions by the governor's office almost daily. Can you give us any information about what's working, what models, who's doing what, and how many counties are using, a specific model? What are you doing for local models that you've created that are showing some promising practices but are not evidence-based? So tons of questions coming out. What's our reach in home visiting across the state, and how do we know that we're reaching the most vulnerable populations? So we have had to convene several meetings just to talk about that, so we can all respond to the governor's office with a unified message around it. And then the second area that we're really focusing on is quality early learning environments, both childcare and preschool. And this is coming also from the governor's office saying, what are you guys doing in First Five that's innovative around increasing quality in family, friends, and neighbor settings, as well as family childcare settings? So our director will put out a query to all of us who are investing in this work, and then we respond, and then she's trying to format it. And it's really just an eye-opener that we need to figure out how to standardize some of this stuff so that we can tell that message better. And now that we're being asked for the first time, really being asked by the governor's office to do that, it really has been a huge motivator, and so we're working on it. But I don't think that's really going to necessarily come across in this document as much. Yeah.
And just to follow up before, if I can, do you think First Five and the association is also thinking about a marketing strategy, a communication strategy? And I like the idea potentially of by topic area that, what First Five is doing for families through home visitation, what they're doing through dental and fluoridation and so on, which I know Sacramento may be doing much more than others. So I like that. But do you see, it often is, I know we struggle with communication and framing our message in a way that both gets across what we are doing and makes a difference to the public audience. Do you see that that's something that is that part of what you're doing? I mean, part of our sustainability plan has got to be that we demonstrate that we're of value and that we get engage and motivate voters and communities to support these kind of efforts ongoing. And so, do you see a marketing communication plan process happening at the state and or association level, or
more at the association level than I do at the state? And if anything, I saw it clearly in the packets and materials at Advocacy Day that they put together with these dashboards. And the front side of the page was, here's what's happening in California around these topic areas. And then the back page was the dashboard specific to each county. So as we went in to meet with our legislators, we could talk about how many kids in our county and how much money and what types of services. And then, but many of the pieces were that statewide story to just say how critical these services are in every county. And then cherry picking a couple of examples of really successful things, including our own Black Child Legacy campaign work and stuff. So I think we get better every year. Yeah.
Did we see, or did you send out, I did not see any of this advocacy data. Could you consider either putting it somewhere on the web that we can get it, or sending it out to give us some example? Because I was actually going to say, have they done a 2-pager yet, of this?
They haven't, but the association has. And so, I'll make sure that you guys all get a
I think that would be useful for all of us.
It's good information.
I think so. And then
the other question, rationale for selecting certified or sustainability efforts in general. So it was 2 years ago, really, that we put it together, 17, 18, and now we're in year 2019. And we had just really launched all of those efforts and had them up for a year, and we were talking a lot about sustainability and thought that at association meetings and other places, we're all asking each other, what are you guys doing around sustainability? Because we all have these fiscal cliffs coming. And knowing that our legislators want to know that too, and what it was just it's so on everybody's mind that we wanted to take the opportunity to showcase, because we are doing a lot more than most counties are, and we thought others could learn from our experience and what we're doing here. So we just took the opportunity to showcase that instead of talking about various programs specifically.
Thank you. I think it's a good idea to be highlighting that, certainly. Yeah. Thank you.
Commissioner Johnson, Turner Johnson.
I just want to underline that topic too, because what was going through my mind is that in the efforts of sustainability, I felt like as you all came forward with the issue of hiring someone that would be an advocate and working towards policy and systems change, and of course we know there are lobbyists for First Five California, and that everyone, including those that were there last week, are very much a part of this. And yet I couldn't help but wondering, which is what you just said, how much investment, in every way, other counties are having, so that what we're doing, I mean, we can talk about program, but we know we've got a cliff. So what we really need to be doing is very futuristically looking at how we're going to use policy to make sure that what we're bringing forth from whatever pockets are most available, accessible, and lucrative to our efforts are worked toward in terms of policy and advocacy. So I'm just curious, even though we know it's going on, and you did make a simple comment just now about that they're perhaps not as invested in the same way as we're so proud that you've been. Other counties. That's what I'm saying. Mm-hmm.
I just don't think that they've done it maybe as formally as Sacramento has. There's a lot of good examples, like First Five Santa Cruz developed something called Thrive by 3, that they are working specifically with cannabis growers and sellers, and they are getting a slice of their local cannabis tax dollars for 0 to 3 programming. Even YOLO, right across the river in the city of Davis, they're getting a sliver of cannabis sales tax going on in the city of Davis for 0 to 5 services. So that has been an area where others are working that we have not been yet. And then I really think that the association is pushing counties along on that advocacy road pretty strongly, and the association has rebranding their foundation side. So the association has 2 different bodies. This is probably more than you want to know, but they have a foundation side and they have an association side. That foundation side hasn't done a lot in the past, but now with the new governor and others, people want to give money to the association around advocacy and policy work. The association could not take it, but they can now because they have a foundation side. So the foundation is accepting large sums of money from Pritzker Foundation, Heising Simons Foundation, and many other foundations, and planning on doing major policy work around advancing 0 to 3 in California, and are growing that whole side of the First Five Association house that has just kind of been dormant for a while. It's always run the AmeriCorps program for the state, with AmeriCorps matching dollars for First Five programs, but now it is expanding and people are knocking on the door. It's like we've somehow we hit the tipping point, and people are coming out of the woodwork, foundations and others, and the governor's office to say, we recognize you're the experts in 0 to 5, and there's this huge interest in what should we be investing in, and how do we advance policy.
Very prudent.
Yes.
And thank you so much for your efforts. I think we'll see more of it.
I think you will, I hope.
All right, we'll open the public hearing, close the public hearing.
Oral health update?
Okay, so for the last agenda item from staff is a very quick update on oral health. We realize we haven't presented to you all in quite some time on the oral health efforts, and so Chris is going to walk you through a quick PowerPoint.
All right. Good afternoon again. I am the program planner also for oral health for First 5 Sacramento, and this will be a very brief presentation on the happenings of oral health in Sacramento County. First 5 funded the Center for Oral Health in 2018, $600,000, along with the dental plans, $525,000 to reach children 0 to 5. And Public Health also provided funding of $508,000 to reach children 0 to 20 that are Medi-Cal eligible. Center for Oral Health provides dental screening, fluoride varnish, and also the navigation to dental homes. Right now, with our contract with First 5, we have requested that they serve 7,000 children annually over a 3-year period, and they're well on their way for quarters 1 and 2. They've reached 4,279 children that have received screening and fluoride varnish, and over 3,500 children have been successfully navigated to their dental home. And one of First 5's capital projects is the Galtwell Space Dental Clinic. It opened in April of 2018. It is absolutely beautiful, stunning, amazing. This clinic serves the Galt and River Delta area. And for quarters 1 and 2, they've already served 200 children ages 0 to 5. And I have been told that a grand opening celebration is coming soon, so we will keep you posted on those details, but I encourage you to tour the clinic. It's absolutely beautiful. And our other capital project for First 5, hard to believe, but First 5 has been in the business of fluoridation for 20 years. By 2019, 68% of Sacramento County's children ages 0 to 5 will receive fluoridation drinking water. Our current contract right now is with Golden State Water for $1.8 million, fluoridating the Arden Arcade area. And after this project is completed successfully, and we hope by December 31st, 2019, 616 children ages 0 to 5 will have received fluoridated drinking water. And I also have one other update with fluoridation. We may soon have the opportunity to partner with Public Health on an upcoming fluoridation study for the Fruit Ridge Vista area. So we will keep you posted on those details. And then on April 3rd, what an amazing day. First 5 and Sacramento Kings partnered to bring Healthy Smiles Day to Noralto Elementary School, when more than 200 super excited children attended this assembly. There was an amazing puppet show that was quite hilarious, with an oral health message of brush your teeth twice a day for 2 minutes. We also had additional entertainment from the Sacramento Kings dancers that did break dancing, which was pretty darn impressive. And of course, Slamson attended the event. And then the legendary player, Olden Polynice, read the book, Potter the Otter Goes to the Dentist. And at the end of the event, all children received a dental kit, and also the Potter the Otter Goes to the Dentist book. And the Dental Transformation Initiative program, this is a program that resides in Public Health. It's a 3-year, $11 million pilot that began in 2017 and will conclude in 2020. Children ages 0 to 20 are the population that DTI is serving, Medi-Cal eligible children. The goal of this program is really to reduce barriers to care, of course, and to increase access to care, and provide oral health education along with raising the Denti-Cal utilization rate by 5% each year. There are 3 pilots with this program. First is the virtual dental home, which essentially is bringing the dentist's office to the school, where a hygienist can perform screenings, cleanings, x-rays, and even can fill cavities while the dentist is working remotely and can review the charts from a secured cloud. The other pilot that we have is the Medical Dental Partnership, and this is where medical professionals are trained on how to provide fluoride varnish and also screen for cavities. They refer children to their assigned dentist, and also the office can bill for Medi-Cal. And then the last pilot is the Community Outreach Parenting and Education pilot, where AmeriCorps workers have been trained to provide oral health education, and they work with parents at the FRCs. They talk about ways in which you can prevent dental disease, how to make your first appointment, and the importance of seeing a dentist by your first birthday or first tooth. And the last program I'm going to talk about is the Sacramento County Oral Health Program, which is funded through Prop 56 funding. This is also known as the Smile Keepers Program, which many of you are familiar with. Smile Keepers has been around for 40 years, and in 2018, they moved away from direct services, and instead, with Prop 56 funding, they were tasked with developing an oral health strategic plan. And in 2018, they completed the oral health needs assessment, and from there, they honed in on some activities that they'll be working on over the next few years, increasing the school-based fluoride sealant program, also increasing the percentage of the population to receive fluoridated drinking water, and working with schools to collect and report the results of the kindergarten oral health assessment, and working with dental providers to provide educational materials on cessation and sugary drinks and beverages, rethinking your drink. Thank you.
All right, Commissioner Wagstaff.
Thank you very much. Thank you for your presentation. On the slide about the Dental Transformation Initiative, DTI, a couple of slides back.
Here, I could do this.
We've been aware of this project, 3-year pilot, 2017 to 2020. And you say the goal is to increase Denti-Cal
Utilization rate.
But I don't see any information on how much that utilization rate has gone up so far.
Well, it hasn't gone up as much as we would have liked. I believe this next month, Public Health will be providing a presentation to the Board of Supervisors that will talk in depth about where the Denti-Cal utilization rate is, and they'll probably be able to provide a little bit more information about that.
Okay, I mean, because as I recall, that's why we started this project in the first place, was to increase the utilization rate. So that's a key statistic that we should have right in front of us, it seems to me.
May I answer?
Yes, Commissioner.
So we do have that statistics, and roughly it started a few years ago at 20% utilization, 80% lack of utilization.
Right.
Now we're up to about 40%. For the most part, 40%. That's still not adequate, and that's what we're still reporting. And that's the context by which all of these programs were initiated to help increase, try to get a comprehensive program that focuses on early intervention and prevention. And we know that the disease is present, caries and oral health is present throughout the life cycle. But if we can intervene early, intervene effectively, maybe we can get that. And so that's why First Five, you talk again about what we were saying about First Five Sacramento doing more than any other, First Five throughout California. Their investment, I think, in oral health is one example of that, plus the sustainability of our investments. When you looked at, just looking at that fluoridation component, the initial dollars that we put in there, 1.8 million for the particular project we're talking about, it's only really affecting 600 or so kids, not very many. But that's 600 kids the first year, not including the virtuous cycle effect of every one of their siblings who are 6 through whatever, or their parents or grandparents. It's also helping them with their oral health. We know that that's the case, and we know that because it's a communicable disease, having infection, dental infection in the mouth of any one of those people, it can be transmitted to the kids. So that particular cycle, that particular funding of the first 5 fluoridation, when we're finished funding, Golden State will continue to fund that for years, 20, 30, 40, a generation of benefit. That's I guess, the gold standard from my standpoint of sustainability of project. We look at also, we try to make it as, a narrow, a deep investment. We're looking at opportunities to leverage, and that's an example of the leveraging. We're also looking at all the available funding streams, including, the DTI. You talk about the DTI grant. That's not coming from First 5. That's coming from additional funding. You're looking at Prop 10 funding, but you're also looking at Prop 56, also a tobacco tax, an add-on tobacco tax. We're looking at, we know that if you look at the pyramid of health, we talk about it and how the health impact. We look at socioeconomic factors. The first strategy is making sure that we have insurance that covers kids. Technically, on the books, we do. Unfortunately, it's not actually effective in getting them into the actual care. And that's why the strategies of the DTI, the virtual dental home, the community outreach programs, trying to tell them, the event at Twin Rivers where we did the oral health to the kids and the parents, it's all kind of important to make sure they hear it in their own locale, that it's important to get in to see the dentist. So I do think it's a very comprehensive program. I think it's well thought out, and it's utilizing a variety of strategies, I think, that affect where it's most prevalent in the socioeconomic factors of race, income, ethnicity, and education.
Thank you. Julie?
I just wanted to be able to respond in another way, too. That is all very true. Thank you for all of that. I think what the Board of Supervisors is going to see is an incremental increase in utilization, sort of heading in the right direction, but it's nothing to write home about yet. And one of the reasons I think, that's just me speaking for that, is that year one, so year 2017, was really establishing contracts. They created working groups. This thing did not really get launched until 2018. And so the data from the Department of Healthcare Services lags greatly in reporting time. So we are sort of seeing utilization data that is, from 2018 and just at the start of things getting launched. I certainly hope that we will see, now that everything is fully launched, is that correct for DTI? Everything
Yes.
is fully launched as of when?
This last year. It took a while to get all the equipment, but 2018 is when the program launched.
Okay.
Yeah.
So I hope that we'll see some increases. I think for Sacramento, they definitely picked the 3 best interventions. It is a combination of those 3 things that should move the needle on utilization. But it's kind of like looking at our African-American child death rates. Things lag behind, and then you have to wait for everything to get fully implemented. So we shall see how it goes.
And may I add that, it's not only exclusively, to your point, is that it's not exclusively First 5 to remedy this situation, but it is at least our, I think, onus to look at it and try to engage and invest in strategies that do move that needle. Ultimately, the dental plans are the ones that are paid to get the utilizations up.
Yep.
And if it's not up, it's their problem. It's our community's problem, but certainly we can be proud of the investments that First 5 has made to kind of move that needle.
Great. Final item. Thank you.
Commission member comments?
I just want to say that Phil and Julie came to the Midtown Association board meeting that I sit on that board and did a presentation 2 weeks ago. that was very well received. And I think it's really important that we're getting out there and getting in front of people who aren't the usual suspects. I mean, I feel like the social service world knows what we do and knows who we are, but getting in front of business people who may or may not have ever heard of First Five, I think is a really good strategy, especially as we look at sustainability and bringing new interested parties to the party. So you did a great job, although Phil stole all your thunder, so you didn't have anything to say.
Yeah, I was practically just ornamental. I barely got to say anything, but that was okay. But we do have another one lined up for the Del Paso Heights business community coming up soon. So we're trying to make that happen.
Great. Commissioner Cossack?
Yes, I wanted to announce to the commission that due to the financial situation of Sacramento City Unified School District, it's a SETA delegate agency. They will be relinquishing about 35% of their Head Start enrollment back to SETA. It's about 403 enrollment slots, and all of their early Head Start program, which is 192 slots, effective August 1. We've been working with them on this reduction to transition 6 of their current operating sites to be taken over by SETA to do the provide the services. And as a result of this, the working families and their children will be able to continue their much-needed services at their current school. In addition, we will be ensuring that no returning family or child will go unserved during the transition into the new school year. SETA, in partnership with its 5 delegate agencies and 2 partners, serve about 5,000 infant, toddlers, and preschoolers in more than 120 early learning centers in Sacramento County. In August 2019, several new school sites will be opened, and we will be offering more enrollment opportunities for children 18 months to 5 years, including 79 infant toddler slots for working families. And if people are interested, they can reach out to us at the SETA Head Start website, which is www.headstart.seta.net, or they can call our main office at 916-263-3804, and an enrollment specialist will assist to identify a location for that family.
Thank you. That's great news. Anyone else? If not, then we are adjourned.
Yeah.
Thanks for your concern.